Welcome to the Perfectly Planted podcast. I am your co-host, Besame Schwering. On this podcast, we have the pleasure of speaking with amazing individuals worldwide to learn more about the benefits of healthy living. If this is your first time joining us, welcome. If you're part of the Perfectly Planted community, we thank you for being here and we hope you really enjoyed this episode. Daphne, hello. How
Good
are
morning,
you? Good morning. I
Besame.
know I know you've been traveling, Daphne.
I have been. I was in California last week, spent 5 days in LA, and was with the vegan gym team, and we just had an amazing time. We spent some time with some of our athletes, spent a day at Farm Sanctuary in LA doing some volunteering, and then took some amazing hikes. I honestly forgot how beautiful the landscape is in California, and especially now after all the rain, it was it was incredible.
Your social media post that you had of your hike was amazing. I was jealous. I was very jealous. But let's talk about what happened here. There was like 3.2 hours of sleep. I'm sure that was time change, not only for the daylight savings time, but also going from coast to coast impacted that.
The Yes. So working across time zones is definitely a challenge, and I want to remind everyone that sleep is your superpower, and I know that our guest today will definitely help articulate some of that, as sleep is one of the six pillars of lifestyle medicine. But I was working Eastern time, Pacific time, and the 3 hours of sleep was all on me. I was trying to get in my workout and then get on meetings for East Coast time. But talking about working across time zones, Dr. Sirotin, welcome to the Perfectly Planet podcast.
Thank you so much. I really appreciate the invitation, and I'm just delighted to be here.
We're so excited to have you here today.
Thank you.
Dr.
So,
Nicole, oh, go ahead,
nope,
Daphne.
nope, you go ahead.
No,
Go
I
ahead.
was just gonna say, I mean, I know that we've introduced Dr. Sirotin, Dr. Nicole. We're so excited for you to be with us today because I know you've pioneered. You've been part of a pioneer with the healthcare organization that you're with to create this lifestyle medicine organization and clinic, and we're so excited to learn more about it. But before we get there, can you tell us a little bit more about your backstory and how your career path has led you here today?
Absolutely. I think that I'm just delighted to be here to be able to share with everyone what is happening here in the UAE with Cleveland Clinic Abu Dhabi, and also what I feel like is happening in many parts of the world. There is a movement that's building, and we're part of it. So I'm just delighted. When we think about our own stories, I think we all go back to our roots and our families and how we grew up. And I can say that I had a pretty typical childhood growing up in the Midwest, which included a lot of fast food and, family dinners, a lot of physical activity. I played organized soccer since I was 5, all the way up until I got pregnant. But the nutrition piece of it was a lot of iceberg lettuce. And in that experience, it wasn't a culinary experience. There wasn't a lot of joy related to the food. And as I grew up and started to really learn more about nutrition and more about health and get into my career, which I'll talk about, I think that it actually I started to want to expand my palate more than anything, really understand different foods, understand how do we get more joy and pleasure out of the food that we're eating. And this really brought me into in and out of vegetarianism and really toward more of a plant-based diet. There was a bounty that was available that you could explore. And moving to the Middle East 9 years ago, this just has expanded even more flavors, more different kinds of spices, different creativity that you can bring into the food. And so I am very lucky to be married to a man who loves to cook. And he is our primary chef in the house. And it's also been very fun to work together. So pulling in kind of the nutrition and the medical side of it, and his joy for cooking has really put us in a place that I think is very healthy, very fun. And now we have my son, who's 9, starting on that path as well. So, but when I think about the career and how I ended up where I am, there's a lot of ways that we think about our own development and all the different things that help shape us. And I had a lucky experience to be able to spend a year in China when I was in university. And during that year, I really explored a lot of different views on medicine, on health, on what goes into to being healthy. Through some traditional Chinese medicine experiences, and then also saw a lot of need, right? This was the 90s, and there was definitely a lot of need in humanity that you could see. And so the combination of these really helped me come into medicine as a profession, because you could have this incredible opportunity to help people. And also there were so many different ways of viewing it. Now, I didn't end up going down the path of a traditional Chinese medicine, but it helped me just expand my view on what it means to be healthy, and how do you look at the body from different directions, and how do you incorporate things that you can do yourself as part of your medical journey. And so I think that this is really where it crystallized for me that I wanted to go into medicine. And like teachers, like religious leaders, we have this incredible privilege where we're with people when they're vulnerable, we're with people when they're riding high, we get to be a part of people's lives, and we get to really make an impact. And that is, for me, just the joy of the job. You really get to be a part of people's lives, and the lifestyle medicine piece is even more, it gets even more granular. You get even more engrossed in someone's whole existence, because this is what we talk about. We talk about how you eat and how you sleep and how you move and how you stress. And these are all the things that make up our life, right? And so this, to me, is the incredible privilege that we have as physicians and as lifestyle medicine physicians.
And Nicole, what took you? So, I mean, you've had an amazing journey. And for those of you listening or watching, I will definitely try and recap. Dr. Sirotin actually shortchanged a lot of her accomplishments in her summary as to how she got here in her career. But why Abu Dhabi? The lifestyle, behavior change is such a key for all aspects of medicine. But what attracted you to CCAD?
So I had a pretty typical academic medical practice. I was at Cornell as faculty after going through internal medicine training at UCSF and some fellowship training in global public health. Came to New York and was faculty both at Montefiore and then at Cornell. And I came to a point in my life where we were, my husband and I wanted to have a baby, and we were thinking about how we were going to do that in New York City with both of us full-time working. And like many big decisions, it's both professional and personal. And so I started to look abroad, and the opportunity to be able to open up a new hospital that was an American hospital in a different country, in a different place, was extremely appealing. And was very lucky to be able to come in from the ground up. And so around 9 years ago, I left that academic practice at Cornell to come here to help open the hospital. And Cleveland Clinic Abu Dhabi is a multi-specialty hospital. We focus on complex care. And we are, at this point, ranked number 1 in the country and number 1 in the GCC, which is a huge accomplishment. and number 2 in the Cleveland Clinic system. So we've really, in our short 7 years of being open, have been able to accomplish many things in addition to our lifestyle medicine program, multi-organ transplants. We're doing extremely complex procedures and care for patients. And so to be a part of this hospital has been just the pinnacle for me. I had the opportunity to lead our internal medicine department, and then we created the Department of Preventive Medicine in 2018 to really help meet the needs of the programs we were planning and of our patients. So within this department, we have our executive health program, we have a concierge style primary care practice, and then we have our lifestyle medicine programs that we run right now for patients with chronic disease, and then also a new program in our cancer center that I'm very excited about.
A new program in the cancer center.
Yeah, so the cancer center has just opened. We have a brand new comprehensive cancer center here. And the idea to include a lifestyle medicine program within the cancer center actually came some time ago, where we had a survey by patients that basically asked them what they wanted. So it was a survey as far as what kind of services were we going to be able to provide. And the patients really spoke. They said, we want nutrition, we want exercise, we want stress management. And so the head of oncology, Dr. Stephen Grobemeyer, has been a very big support of our program from the beginning. And he has helped create space for us within the cancer center. And so every patient with cancer has an opportunity to see one of us as a lifestyle medicine physician. We know that we can reduce the risk of recurrence for breast, prostate, colon cancer up to 50% with these programs. And what we have done is create this multidisciplinary team, which includes a dietitian, a sports therapist, and a psychologist, in addition to the physician focusing on cardiometabolic health, to be completely embedded into the cancer center. And I think that this program is going to make an enormous benefit on patients' lives and really help set our program apart.
That's amazing. I wish that, my wish is that our viewers and listeners will be encouraged to talk to their healthcare provider or healthcare organization to ask about whether or not programs like that exist in their area. Because I think that Daphne and I have spoken to many people, and I feel as though that lacks oftentimes more than it should, because it's not necessarily just the treatment of the condition, but it's the sustainment of your progress and how do you continue in. So how do you engage the community and your patients with embracing more of a plant forward approach? And I guess I also want to know is, you talk about being in Abu Dhabi brings in a whole nother flavor level with, different spices and all, but does the culture help in any way to embrace more of a plant-based, plant forward nutrition?
It's a great question. And, I think we all know food is very cultural, right? This is a part of how we live. It's a part of how our families celebrate. And the UAE is a very multicultural place. We have over 200 nationalities living here, which makes it a very fun place to live.
Yeah.
And one of the things that I admire about the UAE is their approach to all the different cultures who live here. And so there is a ministry of tolerance, and we have cultural events that are promoting tolerance. And with that comes a lot of culinary choice. And with that comes pretty much every junk food from every country and serves as comfort food as well, right? So we really have the best and the worst in ways. But I find that what's happening in Abu Dhabi is what I believe happening in so many parts of the world. This is growing. The younger generation is embracing plant-based foods, thoughts, lifestyle in a completely different way.
Mm-hmm.
Even in the years that I've lived here, when we first moved here, there was one organic farm that we ordered vegetables from. Now there are countless farms. There's a huge push to have sustainable, locally grown, organic vegetables that are available here, and people use them. There's multiple food service organizations that do pre-planned food and pre-meals that are plant-based, and it's completely normal in restaurants to be able to see different options for plant-based. Now there's also a lot of meat in local culture, and so I think the challenge and the opportunity with patients is to really help people see the creativity in a lot of the legumes and the beans that also exist in the culture, and how you can interchange foods, and how you can even add small amounts for flavoring, but to keep the bulk of the dish to be a bean-based dish. So I think that there is a movement and more excitement around that from a nutrition perspective. There's more. It's in everyone's lexicon now. You can talk about plant-based food. People understand that, and I believe that this is happening everywhere.
Mm-hmm.
And Nicole, going back to the culture and what you're seeing in UAE, can you talk a little bit about some of the health challenges? I mean, you mentioned it briefly in that with a culturally diverse community, you're seeing a lot of cultural variance in healthy food, but also a lot of cultural variance in unhealthy foods.
Yeah.
And we can talk a little bit about the highly processed foods that are coming in across the board. But when you're thinking about the 6 pillars of lifestyle medicine, are you seeing that the communities in the UAE are as unhealthy as other parts of the world? And how are you integrating what we know to be the core principles to prevent disease rather than simply putting a Band-Aid on something when it's already broken or trying to reverse disease?
Yeah, I have a good story to start that off with. When we first opened the hospital, a good friend of mine named Khalid, who's still a good friend of mine, he and I met for lunch. He's a UAE national. He was working at the hospital, not a physician, and we met for lunch at the mall next door because we didn't have a cafeteria yet open. So we had our lunch. We came out, and he went to the valet, right? And I looked at him and I said, Khalid, you drove here? We're a block away from the hospital. And he said, yeah, of course I drove here, right? And so there was this extreme lesson in this beginning, because there was an understanding that you would drive everywhere, that the walking was not something that was natural or normal that he would do. And there's a physical space of the city that makes that a little bit hard. But I can tell you now, Khalid's probably lost at least 20 pounds since then. He's avidly exercising, and he's really healthy. And the shift that I've seen in that 8-9 years that we've been here is that things are changing. Things are changing, and we have a problem. We have a public health problem here, like many parts of the world. So we have 70% of our adults are obese or overweight. We diagnose heart disease 10 years earlier than North America. Almost half the population, 42%, are either diabetic or pre-diabetic. And the cancer rates here are really pretty shocking. We have 45% of all cancers diagnosed under age 50. And this compares to about 8% in the US or Europe. So there's a public health crisis, and the system here is set up like the system is in many places, right? We have a reactive sick care system. You get sick, you come to the hospital, the doctors treat you. But just like the very classic lifestyle medicine metaphor, we have that tap and it's flowing. And it's flowing with diabetes and with obesity, and we are just mopping up the floor. And we do a really good job at Cleveland Clinic Abu Dhabi of mopping up the floor. And the healthcare system in general in Abu Dhabi is excellent from a quality perspective. And we have very good mops, and we have better mops, and we have robotic mops, but we're still not turning off the tap.
Yeah.
And so I think what we really are looking to do is to shift away from that reactive model. But the whole system is set up that way, just like it is in the US. You get paid when someone is sick. You have a reimbursement model that is not set up for prevention and lifestyle medicine. And so this is where I think our opportunity lies. And we have really some plans for a new initiative that we'll be bringing forward very soon that include other alternatives for this, really thinking about lifestyle medicine as a way to be able to shift the healthcare system into a true healthcare system, and not a sick care model or a medical care model, right? But really embracing what we can from a prevention perspective. And the shift that I see in the community is vast. We have the amount of new gyms and new exercise areas that are opening. We have an entire island that is being purposed for outdoor activity and indoor activity in the summer, because it's hot in the summer. And we have even in I go to a class, a HIIT class, where I'm very proud that I'm the old lady in the room, right, of this very intensive class. But I'm so inspired by these young UAE national women who are in there, who are exercising, who are extremely fit, right? And even ones who aren't fit, but they're in there and they're trying, and they're really, the effort are there and they're present. And this is about fitness and health. This is not about, kind of other reasons for exercise, right? So I see that shift, and then we can see it in the government policies. We can see it in the way that the focus is about improvement in health and sustainability, and tying that with climate change, and tying that with food security, and this is the movement that I see happening. And again, I think this is global. In many ways, but we have an opportunity here in the UAE to do things a little bit differently, and this is where I feel grateful to be able to be a part of it.
That's amazing. So we ask this often to our guests, and it always sparks additional curiosity. So, what does a day in the life of Dr. Nicole Sirotin look like for you? I know you're busy. You're starting this lifestyle clinic, but obviously, as a mother, I can also relate that you always put like everybody else first. So it inspires me to hear that you're headed to the HIIT class and making time for yourself. But what does a day in the life of Dr. Nicole look like?
Well, you're right. It's busy, and I think that one of the advantages of being a working mom who has a lot of her own hopes and dreams is that it's also easy to empathize with my patients when we're trying to fit things in and talk about how you do things in a way that people feel like they don't have time to do. So I wake up early. I have a walk with my husband in the morning, and this is really important. It's our time. It's quiet. It's just us. We're walking around in the neighborhood, watching the sunrise, hearing the birds, catching up. And that's very, very important time that helps me start my day. And then I fit in my exercise after that, which happens on most days, but some days it doesn't. And I think that one of the techniques that I use that I also try to help my patients with is that when I don't have time in the morning, or I'm feeling pushed for whatever reason, if I can get 10 minutes of intervals on the bike, that makes a difference in my energy. And we know from studies, even 10 minutes of that compared to 45 minutes of a regular exercise plan is going to help improve my VO2 max or my exercise capacity. So I really try to get something in, even if I'm doing old school jumping jacks and some planks, I'm getting something in, right? It just helps me. It helps me. And then throughout the day, I really am trying to get in as much movement as I can. I have a standing desk. I try to take walks throughout the day in between patients, in between meetings. I try to have standing meetings. And, I think this is where we try to do our kind of micro exercises. I actually learned this best from Dr. Scott Stoll. So he and I worked on a project together here in Abu Dhabi last year. It was a year ago around this time. And he's the master of this, right? We'd be walking through somewhere, he's doing his toe lifts, he's getting in some push-ups, right, in between sentences. And I've really tried to adopt that, because I think when you're busy, you got to just get the movement in however you can do it. And yes, I can get to a HIIT class every once in a while. I can do my, longer rides when I can, but I try to incorporate movement. And then food, as I said, I have this amazing cook at home who loves to cook and who's very open to lots of healthy cooking options. And so really looking at my overnight oats and my nuts and seeds and fruit for breakfast. We have a great cafeteria that we have salad, a nice salad bar with lots of options and quinoa and beans and loading up fiber as much as we can. And then I have a nice dinner at home, and I try to get home for dinner on as many nights as I can. And we have our family time afterwards. My son and I spend time together after work. I try to prioritize that after dinner, and then sleep, right? At least 7 hours. If I get less than 6, it's not pretty. I really focus on that. And then for stress, I think this is the one that is the hardest probably for most people, because it just creeps in and it's hard to, it's hard to manage. So I have my ups and downs with my meditation. If I have one thing that I wish I did more of, it's meditate. When I meditate, I am calmer. I handle everything better. Everyone's happier. And, I usually use exercise for that stress reduction portion, but the meditation is really helpful. And then with social connection, this is also central. Living as an expat in a country, you really have to find your people. Yeah. And I do want to have a slight pause for our women's physician group, because right now they are all having dinner together for Ramadan. And they are absolutely a source of support, and I hope that they're having a wonderful time. But we have a women's physician group of over 200 women who are physicians in the UAE, and we are very active together. So between friends and family and the professional support network, this is really what helps me keep going. But it's busy. I try to take time on the weekends. My vacations, I try to go places green and hiking and be outside and get all the lushness that's hard to find here. Yeah. And at the same time, the desert is one of the most peaceful places on earth. And so really getting time out in the desert away from the city also just helps me decompress.
And Dr. Sirotin, thank you for allowing us to pull you away from the women's dinner. I know that being Ramadan, everyone is probably just now breaking fast. So yes. Yeah. Thank you for spending your time with us. I wanted to pull the thread on just 3 things, and I know we probably could spend another hour or so talking about each of them. But you mentioned 1, some special initiatives. 2, the cancer rate that you shared is a little bit shocking to me, and wanting to understand a little bit more around what's going into both prevention, early detection, and treatment. Yeah. And then thirdly, you also mentioned food insecurity, and health equity is near and dear to my heart. So just understanding if you're encountering the same issues related to food insecurity, health equity, in Abu Dhabi that we're seeing in so many other places globally?
Absolutely. So let's start with that one. I think it's a good one. We have, the Abu Dhabi has an amazing abundance of food and food choices. And at the same time, what COVID proved to many people in many places is that supply chain is at risk of global events. And so there was a very large push during COVID to really put food security front and center, with the idea that we live in a desert and there are ways in which we can grow food here that are environmentally sustainable, would be helpful for the people to have fresh food options, and would also be helpful for the environment. And so the push that I think is really remarkable that's happening is the vision of climate change. As many people know, Abu Dhabi is the next host, right, of COP coming in November. So there'll be a very large presence of discussion on climate change here, with the food security element, where you recognize that these two things are connected, and how you can help limit your environmental impact by eating more local, more plants, and less animal products that are more intensive in the environment, and also the fossil fuels that require those foods to be shipped here. So I think that movement is happening, and it's happening in a way that is really inspiring to the entire region, because this is going to be an issue for the entire Middle East. And so I think that those combinations of discussions are right in line with the health discussions. And the more that we can connect them for people, the more I think we will be able to help push the policy in a direction of really encouraging a true health policy, where we're focused on people eating healthier, plant-based, local food that's environmentally sustainable. Your question about the cancer rates is a really good one. And to be honest, we don't have a complete answer yet. So part of the question is, how much of this is genetic? How much of this is environment? How much of this is lifestyle? We know from our determinants of health that 70% of your health is determined by your lifestyle and your environment, and that healthcare is really only 10%, genetics, biology about 20%. So we are going at this with the assumption that it's in line with really a global epidemic of young cancer cases. There was a nice article recently in Nature highlighting this concept that we really actually are seeing a lot of young cancer cases. And the question that then is begged to be asked is cancer becoming a lifestyle disease? We know that there are 13 different cancers that are associated with obesity. We know there's over 10,000 publications associating cancer with colon cancer with red meat intake. And so we're seeing the evidence building, and we know that there are many people who are obese, who have disrupted gut microbiome, who have really a very different metabolic picture, and that is coinciding with this young cancer epidemic. And so I think that part of what we're thinking is that that cancer has a very large lifestyle component. And so the key with cancer prevention and also cancer treatment is to be able to address that more head on. We know with breast, colon, and prostate, the data are very clear, especially with exercise. If you start exercising after your diagnosis, you can reduce your risk of recurrence by up to 40% in some of those in those three cancers. So really looking at how do we help patients with cancer? How do we empower them with these tools? How do we help them understand that evidence to say cancer is a treatment process that is for many patients long and hard, and that they don't have a lot of there's not a lot of choices in that. This is really something that's imposed upon you for good and for good outcomes, right? We have very good outcomes with our traditional cancer treatment. But alongside that traditional treatment, there are these tools that people can have, that people can use, that we can empower patients with, that will help them have less cancer-related treatment side effects, have less recurrence, and less metabolic disease afterwards. Women with breast cancer, if they have a heart attack after their breast cancer diagnosis, they have a 60% chance of that cancer coming back over a woman who doesn't have a heart attack. So there are these shared mechanisms that we're still learning about between heart disease, between obesity, between diabetes and cancer. And part of this comes down to this microenvironment, right? Part of this comes down to the genes that are stimulated with the dysfunctional adipose tissue or fat cell. And we know that those dysfunctional fat cells create inflammatory markers like IL-6. We know that they create insulin-like growth factor. We know that they help promote some microangiogenesis where the blood vessels are being formed. And so that microenvironment then is more conducive to the tumor growing. And so the more we are approaching cancer from a lifestyle perspective in conjunction with the conventional treatments, I think the more we are able to really look at it comprehensively. And so the goal is to see the epidemiology that's happening around us and to try to make those connections both on a disease state perspective, but also on that micro level. And I think this is where the science of epigenetics is showing us what the value of lifestyle is. Like lifestyle and environment are 70% of your health. It makes sense because how you're moving and how you're sleeping and how you're eating are directly related to which genes are going off and on. And those genes are going to be determining in some people whether or not you get cancer or that it interacts with something in the environment that creates that, and or your genetic mutations that you're born with. So I think that all of these ideas are converging into these shared mechanisms, and we're learning that more day by day. So I will talk briefly about this new initiative because it is very exciting, and I think the science of epigenetics is at the center of it. We know that we can learn a lot more about people than is currently available in our traditional healthcare system, and this is where precision medicine is going. We're able to find out much more about a human from their genome, from their proteome, from their microbiome, from their different traditional blood tests. And I think that the future of where we're headed is to be able to take that information, understanding it more about a human, and then applying the lifestyle medicine principles. So really combining the concept of precision medicine with lifestyle medicine to be able to say what's going to work for you and what's going to work for your mother and what's going to work for your cousin. And those things might be slightly different, but all with the same principles where the evidence lies in helping us get towards a healthy, joyful, active, plant and fiber filled existence. And so the goal is to be able to really work with the government here to help put forward this new initiative in conjunction with the Emirati Genome Project, which is a national genome initiative that is very exciting and really at the forefront in the region, and to be able to help implement these programs within lifestyle medicine that'll help us prove the model, which we need to prove in lots of different environments, that this is actually the best way to prevent and reverse chronic disease, and then to be able to show that there's a cost benefit for a healthcare system if you can do that in an effective way.
Wow. That is going to be fascinating.
It's it's really exciting. And I have to say there's a movement that's growing here within lifestyle medicine. We have about 30 physicians that are gathering and excited to be able to create, their own organization. And we're planning to bring conferences and licensing opportunities to the UAE. So there's a lot to come.
Oh,
And thank you for sharing that, because you kind of hinted at it and we weren't certain where it was going to go, but being able to bring together all of those different factors is going to be amazing.
Yeah.
We're going to have to come visit you.
Yes.
field trip.
It's a special place. I think we have a great opportunity here as the ecosystem is evolving very quickly. It's a young country, and there's things that are happening at lightning speed in some of our sectors, and we can see that there's a push towards more of a different approach with healthcare here, and how do we do it in a way that suits the needs of the population, and then also is aligned with new ways of managing a healthcare system on the whole.
So, Nicole, first of all, thank you. And I want to be respectful of your time because I know it's late there. You mentioned two things, and they just really resonate with Resume and I, because the reason we started Perfectly Planted was to engage people, to educate them and empower them. Do you have any seeds of wisdom, words of gratitude or knowledge related to education empowerment that you'd like to share with our listeners and viewers today?
Sure. I think that the inspiration always comes from our patients, right? And I have a patient that I met 5 years ago. He just turned 60. He is someone who came into my office for the first time and said, "Doctor, I'd like to come off my blood pressure medications," which is not your normal first visit with your patient. And at the time, he had just read the China study and had lost already probably 20 pounds or more, and was motivated completely. He had radically changed his diet, changed his approach to exercise, right? And my job was just to remove the medications, which is a very easy job, right? And so we had, over the course of a month, we got him off both his blood pressure medications.
Wow.
And he's still doing fantastic. And so what I think is really inspiring about it is that anyone can change, right? At any stage in your life, at any point in your own journey, there is an opportunity to be able to shift gears and change your own health. And what's even more impressive is that now this same person is involved with this new initiative to try to help us change what's happening here in the healthcare system, right? And so, and as he went through his own transformation, as did his family, as did people who worked for him, right? And so the inspiration that I get is this idea that what we're doing and the way that we can shift the world is through this one by one, patient by patient, person by person transformation that happens when people feel it, when they feel this feels good. I feel joyful. I feel energetic. I feel like I can do lots of things that I couldn't do before. And that goes hand in hand with their health. And so I get inspired with patients that kind of come to me already on their journey. And I get inspired by patients who I can help along the way a little bit more directly. I joke with Ibrahim, the patient I'm describing, because I say I'm not, we're partners here.
Yes.
Now, I mean, you should be practicing alongside of me, because he's really, taking care of himself. And I think the other thing, when I think about the journey and when I think about what we were able to accomplish here in Cleveland Clinic Abu Dhabi and also in other parts of the lifestyle medicine world, is just we have so much openness to people helping each other. When I was interested in starting these programs, I cold emailed people. I called them on the phone. I said, we're starting this new program. I'd like to learn from you. And how do I help with, the cancer program? I had been practicing lifestyle medicine, but I was new to cancer. And so really being able to reach out to other experts and the amount of people who just open their doors, help share ideas, helped me think through, how to action this, was just amazing. And so I think this is where the lifestyle medicine community within the physician and clinician group is really just a special group. We help each other in so many ways to be able to start new initiatives. We have a physician who from CCAD who just started her own lifestyle medicine company, and she's up and running and doing her workshops, and it's just fantastic to be able to see that grow and grow and grow. And it really does come from that joy and that beauty that we feel when we know that we're helping patients in such a fundamental way, and then they then can go on and share that with other people and share that in their work and share that in their family. And that's how the seeds grow, right?
That's how the seeds grow. Yeah. And, as we wrap up, we actually were able to speak with Dr. Rock and Poe 2 weeks ago.
That's right.
And during another conversation, would love to chat with you about how we make it sustainable, because I think that's one thing that Poe really, just eloquently shared, that having all of this knowledge is great and being empowered to make these lifestyle changes. But now going back into his home environment, how does he really integrate it into the fabric of his life,
Yeah.
knowing that there's a lot of moving parts that he has to navigate?
Absolutely. And, I think this is, Poe was part of this very special program. This is when I got to know Scott Stoll and was part of the immersion. And immersions are incredibly powerful for people. But absolutely, we know that sustainability is hard. And even for people who have been doing this for a long time and who live and breathe this, right? Sustainability is hard. I still am trying to get back to my meditation plan, which has gone off the rails, right? So it's hard. And I think this is where we have to really focus on our small wins. We have to come back to the things that we know have worked for us in the past. We have to, we come back to the very small habits that make us feel accomplished and can keep us going in these times that, we feel like we've gone back to old habits or haven't made as much progress. And I think just keeping that big picture in mind while we can refocus is what's most useful for people. But it is hard. And this is where I think the joy piece has to come in, right? Where we really have to say, okay, my goal over here is, yes, to be healthy and to eat, and all of that has to be there, but we have to have joy at the center of it. We have to have joy and fulfillment and just, this is life. We only have one of it, right? We want to feel that every day we have that energy and that excitement and that zest. And so tying our behaviors and the habits with that goal of this is my energetic self can help us remember that these are the pieces that are needed in the very small level, in a very daily day-to-day life when we're struggling with things. And I think that this is where we try to help inspire patients. And sometimes we need to shift gears and we have to take different tactics. And at the end of the day, this is a journey. It really is. I mean, this is the beauty of lifestyle medicine, is it is your life. It's how you live. It's how you feel and how you breathe. And so being able to know that there's always a chance, there's always an opportunity to shift even in a small way, to help either get back to a path or get on a new path, and that it's always available for us.
1% every day. So, Nicole, thank you. I mean, the comments from our viewers today have definitely resonated. Everything you shared has resonated with those listening and watching, because what you're saying is the direction we need to go. And just so excited to see all that you're bringing to Cleveland Clinic Abu Dhabi, to the Emirates, and more importantly, all that you're sharing with us. And I hope you'll give us an opportunity to touch base with you again as this initiative continues to evolve.
Great. I would welcome that so much. And thank you very much for the opportunity to share it. We are trying to do as much open discussion and education about the UAE and about lifestyle medicine here and how we're growing. So I just really appreciate the opportunity.
Besame, you want to bring it home?
Yeah, no, thank you so much, Dr. Nicole. We really, again, echo Daphne's sentiments. It's been a pleasure, and thank you so much for taking time out of your personal life, essentially, because this was the evening to have that social and family aspect. So we are grateful for you for doing that. Thank you, and would love to have you back again. We do want to thank all of our viewers and listeners for joining us today for another Sunday Seedling. If you're enjoying these Sunday Seedlings, please feel free to share them with your family and friends, and go ahead and hit subscribe, like, and comment. We love to hear feedback from all of you on what more you would love to hear. Dr. Nicole, again, thank you so much. And we thank all of our viewers. We hope you all a well Sunday.
Take care.
Thank you.